What's going on? Welcome to another episode of the Impel Forward Podcast. I am your host, Leon, and today I have with me a special guest, Mr. Dr.
David
Martin. Yes, he is my chiropractor. He's been my chiropractor for
quite a few years now.
Yeah, it's been a minute.
I mean, it's been a few years.
Yeah.
It's been a while.
Yeah, and we're going to have a great conversation. We're going to talk about why are y'all scared to go to the chiropractor? We have a lot of people. So, what's going on? How's your day?
Man, it's been great. I got a couple little boys, 4.5-year-old twins. They're the light of my life.
Yeah.
And so yeah, I've been spending time. I spent the morning with them, running around, shooting BB guns, and stepping in mud.
Right.
So,
yeah.
It's been great.
Yeah. So tell me, how did you get started in chiropractic?
Man, when I was in high school, probably like a lot of kids, I didn't know what I was doing, and I didn't know what I was looking for, and ended up at a job fair. And like at our school, they would like drive us all over to like a community college in these buses and dump us all off as mainly an opportunity to like talk to girls. But we had to take these classes and like listen to different kind of professions. And so I remember I picked out like a medical doctor, a physical therapist I went to, an accountant, even though I have no interest really in accounting. But you had to like fill the 4 spots up. And the last one, I was like, I didn't know what to do. And I saw this profession called chiropractic. And so, so I just took it, not knowing what I was getting into. And the medical doctor talked about like all the money that he made. The physical therapist worked with professional athletes. So he talked about all the famous people that he knew. And of course, famous people are kind of interesting, and making money is always great. But neither of them sparked any kind of interest for me. The accountant I had no interest in.
Right.
But the chiropractor was hilarious, man. He was like this old guy dressed in like polyester like golf pants, and this is like back in the day. It was like 1990 probably.
Right.
And so he had like polyester like golf suit on, and just held up a chart of the nerve system of the spinal cord and the nervous system, and it was like, man, we help people with all kinds of illnesses that without drugs and surgery. And it's the greatest profession in the world. And I was like, that sounds kind of cool. I went home and talked to my dad and mom about it. And turns out my dad's best friend was a chiropractor when they were back in college, when my dad was in college. That was like, 25 or 30 years before that. And so I called the guy up, went and spent some time with him in his office. And I had a really impactful story that happened there, which I'll just give you a quick synopsis. But basically, I went and spent 2 weeks with the guy, following him around, and he had a woman come in, young woman, like 23 years old, had like really bad like abdominal and pelvic pain, and it had been going on for a couple of years. And she had seen a number of different practitioners, healthcare providers, and they'd recommended this and that and the other thing. And finally, they just said, "Hey, look, we don't really know. We think you have this condition that's from the nerves. We have to go in and cut the nerves around your pelvis and your lower back, around an area called the sacrum. We're going to just give you what's called a sympathectomy. We're going to cut those nerves. You will not feel any pain when you wake up, but the result of the surgery is that those are nerves that go to the uterus. You won't be able to conceive. You won't be able to carry a baby." And she was like, "You know what? I'm in agony. I got to do it. I can't live like this." So she had the surgery, woke up, anesthesia wore off, and she was in just as much pain. So the surgery was totally unsuccessful, but was successful in making her infertile. Never able to carry a kid. So she came in a couple of weeks after recovery, saw my friend, my mentor now, and started getting chiropractic care. And within 6 visits of getting her adjustments, she was completely better. So he was mad. She was crying. I was crying. I'm like 19 years old, and watching this girl's life that had just been ruined by a medical procedure that didn't need to be done if she had done something conservative and safe like chiropractic care in the first place.
Right. So a lot of people they're not even aware of what chiropractor, what all the help it entails as far as how it can help the body. Now you mentioned medical, like it helps you without any prescriptions or anything like that. How does that work?
Yeah, I mean, we don't believe in drugs and surgery, basically. I mean, it's not that we don't believe in it. It's just like that's the last resort, right? It's like your body your body knows how to heal. Like if you cut yourself, like your body knows how to pull that together. If you get exposed to I mean, this would be another subject, but COVID.
Oh yeah.
Right. But we should get there. All right. We should get there.
Yeah.
But your body knows how to heal. Your body, if you manage your body has a remarkable ability to recover. So, I mean, modern medicine's only been around for what? I mean, a couple hundred years at best. We've been on the planet for a very long time and haven't needed modern medicine. And people's lifespans have been just as long as they are now, even with all of the modern interventions that we have. So it's not like modern medicine has come along and like all of a sudden like increased our lifespan significantly. Chiropractic works by encouraging, by providing your body an environment to heal naturally, to repair on its own without drugs and surgery. And how does it work? Because the body is controlled by the nervous system. And the nervous system, a big chunk of it travels through your spine. And if the spine is out of whack, for lack of a better word, what chiropractors would traditionally call a subluxation, which is really just a fancy word for meaning a joint that's not moving the way that it's supposed to, that joint cranks down on the nervous system and it just creates stress in your nervous system. And if your nervous system has stress on it, it doesn't adapt, it doesn't heal, it doesn't repair, it doesn't communicate well with the body. It doesn't allow the brain to communicate well with the body, and the body breaks down. So it's kind of like any wire going to the microphone or whatever, going over the screen. It's like if the wire's chafed and getting ground on, then it's only a matter of time before that wire doesn't carry the signal the right way.
Yeah. So. Now, can you recall? I took a picture some months ago, but I changed my phone.
All right.
I took a picture in your office in the room. I think does it have a hat on the wall? And it says something on there. Do you know what it says?
It says every organ in the body is connected to the one under your hat.
Right.
So you got it. It's like the brain is controlling and kind of coordinating everything that has to happen in your body. But if the spine's under stress and putting pressure on the nerve, then those messages are interrupted and the body doesn't manage that very well. So my job as a chiropractor is I'm a little bit like a car mechanic, I mean, it's like, don't overcomplicate it. If the spine's not working the way it's supposed to, you don't need to stretch it or exercise it. You don't need to medicate it. You need to restore the normal alignment and movement.
TV. Let me grab it.
No problem.
But you can keep going.
All right. Well, bam. Where is it? I got an extra TV actually. It's about that size if you need one. I just pulled it out of our attic trying to figure out what to do with it.
Yeah. Well, go ahead.
So I'm essentially a mechanic. You're trying to figure out where the spine is not working the right way and try to restore the normal alignment and movement of that part of the spine. And it doesn't usually need medication or surgery or a lot of people ask about PT or doing exercises, or is there a magic stretch to do? The answer is no. It's a lot of times it's not. That's not the answer. And the reason for that is that it's kind of like your car. It's like if your transmission's grinding around, making weird noises, like it doesn't need to be driven to Florida to fix it. You know what I mean? It's like that's not going to make it better by using it more. It needs to be fixed the right way, and then you can drive it as much as you want. It's like your car tire. If the car tire is misaligned, driving it more doesn't help it. You got to get the alignment you got to correct the alignment issue, and then you can drive it wherever you want.
So why do you think people are scared to go to chiropractic? It's scared of the neck cracking and the back popping?
Well, that's a good question there, Leon. Why do you think people are afraid to go to a chiropractor?
That's why I think, because I got a couple of people that they say, man, they ain't going to no chiropractic.
Okay.
Do they pop your neck? Yeah, they pop your neck.
Yeah.
I mean,
and so then what? What's the concern there?
I don't know.
All right.
That's why I try to. Maybe they're scared you might break the neck.
Break the neck off, or so rip their head off, or something. Yeah.
I don't know.
Yeah, that's what I've heard too. I mean, we've probably heard the same stuff.
Yeah. Now you teach classes. You still teach classes? Like I know you be having the classes during the week.
Yep.
Now, do people have to be a member to come and sit in on your classes?
No. Anybody can come in. We do usually like one event a month. I don't do a ton of the classes anymore, but we do at least one class a month. And sometimes we do it on, safe kind of exercises for your back, or we've done stuff on like inflammation, on, naturally handling like high cholesterol. So kind of natural alternatives in a way. We definitely do like educational things on chiropractic, like what is it, what it can help. It helps a ton of concerns with kids and young people. I'll circle back around to that in just a second, but let me just say one thing about the safety issue. This is a huge topic, actually, because a lot of people are nervous about it, right?
Right.
So I'm going to say something that's a little bit probably controversial here, but and I doubt you know this.
Okay.
All right. So have you ever heard of the Wilkes versus the AMA? It's a court case. Wilkes versus AMA.
No. I'm not sure. It seems like I've seen the Wilkes thing somewhere, but probably not.
It's probably not because it was a chiropractor who sued the American Medical Association in the late 80s. And by the time it worked its way through the court system in the early 90s, the chiropractor kind of kicked the AMA's butt a little bit. So, and just a long story short, if you were a member of the dues paying member of the American Medical Association, part of your contract with them, part of your agreement with them was that you were not permitted to refer to a chiropractor. So the whole profession, the whole medical profession at the time, 90% of medical doctors were part of the AMA, were part of this membership only group. So, and it's a powerful lobbying group in front of the government, in front of Congress. So if 90% of the medical doctors were part of the AMA, the AMA said medical doctors can't participate with chiropractors. And so there were, during the discovery process of this lawsuit, checks written to like Ann Landers, who used to write an advice column in the newspaper about like, what to do if you're visiting your grandmother's, boyfriend's house or something, your boyfriend's grandmother's house or something. She would like write all kinds of like advice for people that are in kind of sticky situations. So anyway, there was a check written to her from the American Medical Association to say negative things about chiropractic. It was in like magazines like the Reader's Digest and Popular Mechanics, like all negative ads, all negative publicity around chiropractic. You know who paid for it? The American Medical Association.
Right.
Why? Because there's a huge market share of people that would prefer to get non-drug treatment for their healthcare. But if the American Medical Association scares the crap out of people and tells them false things about chiropractic, then they come running back to their medical doctor for more drugs. So they have like perpetuated these lies about safety issues within chiropractic that are flat out not true. So I'll give you an example. How much do you think I pay for my malpractice insurance in case I kill somebody, by adjusting their neck? How much do you think I pay for my malpractice insurance for a year?
What you pay now for a year?
Yeah, I pay my malpractice insurance for the year, so if I get sued, I get coverage. But how much do you think I pay? I mean, you hear about these like malpractice insurances are putting people out of business, like putting medical doctors out of business because malpractice costs so much.
I'll say I might be thinking too big. I say 20,000.
Okay, I guarantee you're thinking too big. That's how much some medical doctors pay. You get to sign like high risk professions. So like obstetrics or neurology or some surgical stuff. They have to pay huge numbers of for their malpractice.
Why? Something like 20,000?
Yeah, because they're getting sued. Because they're doing stuff that can actually kill people and save people, but kill people. So it's dangerous. I pay under $1,000 a year for my malpractice insurance. Why?
Probably because you're not using medication and you're less, what's the word?
Dangerous.
Less dangerous.
We're not killing people.
Yeah, right.
We're not killing people. So you're not killing people. So the insurance, listen, if the insurance company could make money on our malpractice policies, they would make money on our malpractice policies, right? They would bump the rates up. If they're getting sued and they got to pay money out to people that are getting injured, then they'd be raising the rates on us. But I pay literally under $1,000. I think last year was $960 something for my malpractice insurance. Wow. Because chiropractors don't get sued because we're not hurting people. We're not killing anybody. No heads are popping off.
Wow. So you mentioned something about you teach how to lower cholesterol naturally. Is that through chiropractic work, or are you touching naturally
No,
medications?
other natural approaches.
Okay.
But basically, a lot of those classes are really just trying to get people to think naturally.
Right.
Moving away from dangerous medications and surgeries. So chiropractic fits firmly under a natural healthcare umbrella that I think is, very important for people to understand, because we're getting like bombarded with messages all the freaking time about medication
Right.
and his lifestyle medications. Like pharmaceutical companies, they're not putting money into like new antibiotics.
Right.
Because you take antibiotics for what? A week, 2 weeks, a month, maybe?
Right.
Where are they putting their money?
I heard that destroys antibiotic. What they say, I've heard some people say it's good for a short period of time.
Sure, if you need it, if you even need it, it's true. But that's not where the big money is in pharmaceuticals. You know where the big money is?
Where?
Lifestyle medications.
Yeah.
Lifestyle medications.
So people take a lot of medication and they never get off of it.
That's really the lifestyle.
Yeah.
Forever.
Yeah.
Like cholesterol, diabetes, high blood pressure, weight loss.
And it never helps.
Well, it depends what you're looking for your outcome. It helps with a very limited subset of things, but it doesn't help with the long-term big picture of things. So, the classic example of that is cholesterol medication. So that's why we kind of hit that one kind of hard. It's the classic example of a medication that you never get off of. So when do you stop? When my number gets to a certain, like when I bring my cholesterol number down to a certain amount, no, you never get off of it.
Yeah. So I've seen certain doctors talk about cholesterol, and a lot of people don't understand the numbers. And they say when your body needs cholesterol. So
100%.
when you bring it down, it can affect your body
100%.
in a negative way.
100%. What's your brain made of primarily? Cholesterol. What are your reproductive hormones made from primarily?
Cholesterol.
What are all of your nerve fibers that covered in? Cholesterol. What are all of your blood vascular tissues lined with on the inside to make the blood cells slide along smoothly? Cholesterol. It's all cholesterol. Your liver makes like 80% of the cholesterol in your body. So
what's going on? I hope that you are enjoying this episode, but I wanted to take the time out to ask you to please subscribe to the podcast. I've noticed that a lot of people are watching but are not subscribed. Make sure you subscribe, like, share, and don't forget to hit the notification bell. That way you won't miss an episode when it's aired or about to air. And also make sure you go to impelforwardmerch.com. That's impelforwardmerch.com. Grab you something. Now back to the episode.
So cutting out dietary cholesterol doesn't do much of anything. So the whole thing was a lie. I mean, eggs are bad for you. Red meat is bad for you. Butter is bad for you. Because they were trying to like say all these things are bad for you for cholesterol, but that stuff doesn't really move the needle on cholesterol at all. Instead, they were saying, okay, take all this, don't eat this stuff because it's bad for it. Eat this other chemical crap and take our cholesterol lowering medications. So you probably know this because you kind of pay attention to some of this stuff, but 50 years ago, cholesterol was whatever, 250, let's say. And then it came down to 230, and then it came down to 200. And now it's like there's a push for 180. It's like, so you start driving your cholesterol numbers down that low, and you're going to start getting dementia because you're affecting the cholesterol of your brain. You start driving cholesterol that low, and you're going to start getting neuromuscular problems because all of your nerve endings are lined with cholesterol. You start driving your cholesterol that low, and you're going to get reproductive and sexual performance problems because you don't have all of your cholesterol is made from, or all of your sex hormones are made from cholesterol. So people, you start taking high cholesterol medications to try to drive those numbers down, and you start getting dementia, you start getting thinking problems, depression, fertility issues, erectile dysfunction, neuromuscular issues, you know what? They've got a solution for all that. You know what it is?
What?
Medicine.
Medicine.
More prescriptions.
So the key thing is that I've been seeing doctors talk about is paying more attention to your triglycerides, and I think the triglycerides and your HDL, as far as keeping your triglycerides low.
How do you do that?
Not too high. Stay away from sugar and the junk food.
Bingo. So yeah, it's not fat driven. In fact, your body, listen, people eat, I mean, you've heard of a carnivore diet, right?
Mm-hmm, yeah.
I mean, so people are eating carnivore diets and have perfect cholesterols. How does that happen?
Right.
It's not the cholesterol that you're eating in your diet. That's not the problem. It's the sugar. It's the grains. It's the fake oils. It's the chemical compounds that we're putting in our body that have no business being there.
So let me ask you this.
We're off chiropractic now.
Yeah, we are, but I'm glad we're here because I've been we gonna go back to chiropractic.
Okay, right
on. I watch a lot of doctors talk.
Okay.
I watch a lot of holistic black, I guess holistic, I wouldn't call them doctors. I guess holistic people.
Healthcare provider. Healthcare, yeah.
And I've been wanting to find out and distinguish the difference between, so the black people, they don't mention the human. They say we can't eat this as black people. We can't eat what white people eat. Can you talk more about that? Because I'm trying to understand that. Because I never hear the white people mention. They mention us as human.
Yeah.
We can eat. Yeah. Is there a difference?
No, there's definitely a difference.
Okay.
I mean, there's definitely a difference.
Mm-hmm.
It's not. I'd be hard pressed to come up with a lot of examples of that. But I'll give you one kind of classic example of that. And I should say, I mean, every single individual person is a little bit different anyway. But then there's certainly racial clusters of unique problems, right? I mean, so in the black community, for example, it's way more common for you to have this genetic issue with sickle cell anemia. You know, so of course you can look at like groups of races or racial groups breakdowns and say there's certain things that you're more susceptible to or more likely to have genetically, or things that you should or shouldn't eat because your bodies are, you know, our bodies are different. And one classic example of that, if you look at like the statistics of people that are sensitive to lactose in milk.
A lot of black folks.
A lot of people, but you're right. It's the highest level of sensitivity per capita. Like you take 100 people that are black, and black people have the highest level of intolerance to lactose. I forget who's next, but it's maybe brown people are the next least likely to have problems with it. And it gets down to, it turns out Caucasian people have the least amount of sensitivity to lactose. There's still sensitivity. So like, I forget, 3 or 4 people out of 100 are like completely lactose intolerant, but the number goes up significantly by race. And I think that's, hugely underappreciated when you're talking about making recommendations for medications and for lifestyle habits and so forth. So, I think that's a blind spot in healthcare.
All right.
So now 80-90% of what is recommended that's healthy for one group is probably healthy for another group. But I would never go around and say, like, for example, milk, everybody should drink a big glass of milk.
Right. Yeah. That's funny. I used to drink milk a lot when I was younger.
Yeah.
I used to
How do you do with it?
Now?
Yeah.
I can't. I don't even drink it no more.
Me neither. I don't drink it either. Cow's milk is for baby cows.
Yeah. Now, so what do you think about the
ice cream?
No, not ice cream. I definitely can't do the ice cream. But you eat ice cream?
I love ice cream.
The grass-fed, and a lot of that is, and you got to do a lot of research on the grass-fed and what's not really grass-fed and all that. Right. So when I do it, I make sure it's grass-fed, 100% grass-fed. At least that's what it say.
Yeah.
Do we really know?
Do we believe them?
Yeah.
We don't know.
Yeah.
Yeah, Lee, and I think looking at, to me, one of the things that has surprised me, that has been like a source of confusion to me, has been the trust that people put in medicine, in the medical profession. When we know, I mean, that there has been not only massive amounts of corruption, but mistreatment of people. And I mean, you brought up kind of the Black issue with healthcare. I mean, I think that there's no question. I mean, from medical testing, like the Tuskegee Airmen, with syphilis, with vaccine testing in African countries, like, to me, it's unconscionable what has happened, and the fact that in the Black community, like obesity and high cholesterol and blood pressure issues and diabetes are such significant issues, but it's a captive audience. Like, where else are you going to turn for your medical advice? But we keep going back to the medical profession as though they're going to fix this issue, and they haven't fixed the issue. Yeah. And there's more medications to be sold there.
It's just like I had this thing for them for years and years. They've been raising money for cancer. Years and years raising money for cancer.
Bingo.
And nothing.
No. That Susan B. Komen thing, we got asked to sponsor a race for them recently, and I was like, I'm not sponsoring a race for Susan B. Komen. First of all, they got money, first of all. Second, they haven't come up with one solution yet or said one negative thing about, there was a big study sponsored by the National Institutes of Health for women with taking birth control, and it turned out that there were so many women that were having heart attacks taking the birth control medication that were part of the study that the National Institutes of Health canceled the study. They were like, "Holy crap! Like, we're killing people. We got to stop this." Do you think Susan B. Komen said anything about that? Like, it was for breast cancer. It was looking at birth control and breast cancer, estrogen replacement, hormone replacement therapy, and breast cancer, and but so many women are having heart attacks and dying. And so they canceled the study. You think Susan B. Komen had anything to say about that?
No.
Silent.
All right.
You're like, come on. And now we're going to go give them some money so they can, like, do what? What are they doing? I don't even get it.
Yeah.
So.
And it's like people, conspiracy. I'm a conspiracy theorist.
Oh, me too. You're a good company. Yeah.
I know me. We conspiracy theorists. Exactly. Because most of the time is where there's smoke is fire.
Right. Exactly.
And as things start to come out, it's even like with COVID.
Yep.
I was on it in the beginning. I seen a couple of things to different people.
Yep.
Some people believe it, some people don't. And I think what it is, a lot of times we scared to unlearn things.
Yeah, that's right.
And we stuck to this. People act like they don't believe in the government, but they do.
Yeah, exactly.
They're some of the most corrupt.
Exactly.
And like COVID, that was
nuts. Listen, I want to come back to that because you know that's a favorite subject of mine. I want to say one thing about weight loss and diabetes medications. I think it's Ozempic, right? Ozempic, and what's the other one that starts with a W?
Waygo or something?
Yeah.
Like that?
Yeah, because I think they did this big advertisement on the Super Bowl.
You can move this out.
Nah, you're all right. It doesn't matter. So, I think Ozempic, if I'm not mistaken, it's made in Denmark. That's where it was like discovered, patented. Guess where you legally cannot buy Ozempic? Denmark.
Oh, what?
Like where they made it. You can't even buy it there. You know where they come to sell it?
Over here.
The United States. Yeah. So it's like, they know that it's a lifestyle medication. You know what I mean? It's like you're eating crap. Your body doesn't know what to do with it. And so it starts getting inflamed and blowing up and like making too much blood sugar. It's like you're getting like insulin intolerance. And it's just like, it doesn't know what to do, So you get a medication for it. But the Danish people in Denmark know that this stuff is so dangerous and it's for a lifestyle problem, not like a real genuine medical issue, that they can't even license it. They can't even sell it in their own country. So it's bananas, but they know they can sell it to fat Americans.
Yeah. So that's that's like the stuff we have over here in all our foods, but they're
legal
in
Europe, exactly.
in other countries,
European countries, exactly.
Yeah, that's why I like what All right, here we go. Is it Robert F. Kennedy?
Yeah, RFK.
I like what he's doing with the food, taking the dyes and things out of the food.
All right, you're gonna put that out there?
Yeah, I like it. I'm putting it out there. I like it. I don't.
100%.
I like it. When it comes to health, I like that.
Sure. Listen, the guy's got problems. I mean, he's, maybe I wouldn't want to be his best friend or his next door neighbor,
Right,
but maybe I would.
Yeah.
Maybe he's perfectly fine. I don't really know because I don't know the guy. You know what I mean? Like, but I'll tell you, he's asking questions and doing stuff and making recommendations that nobody else has had the courage to do.
Yeah. And see, that's the thing. You got to ask the question because people may not like him,
right?
But if you just ask the questions and go look and see. Now, I'm not even talking about the vaccines. I'm talking about food. That's what I'm talking about.
Right,
food.
Exactly.
If you go, man, you look at your dish detergents, your candles,
cleaning products,
your plug-ins.
Plug-ins.
Y'all go do your research on all that. Your plug-ins, even fragrances.
100%.
Go do your research on all that.
100%.
Man, even your tissue. Go look at your tissue. Pull up, go look up tissue and see what's
it's true. I keep forgetting we're on video here, but yeah, you're right.
Yeah,
you're 100% right.
Yeah.
Listen, he's asking the questions that nobody else has asked before. Right. And you know what? People say like, oh, he's not a scientist or he's not a medical doctor. Right. You know what? I'm going to just say, that's an ignorant thing to say. Mm-hmm. And you know why it's a stupid thing to say? Because most of the people that have held his position over the last 30 years also, turns out, have not been medical doctors.
And a lot of people probably don't know that.
No, it's an administrative position, and he's an administrator. Right. Like first of all, he's a lawyer, and you know what one of his famous lines is, which I just freaking love? Yeah. He's like, because he's like going after, he's like asking questions about vaccines too. And I mean, whether you agree or disagree about vaccines, it's like, have you asked the questions? You know what I mean? Like, have you even ask the right questions about it. Right. So one of the things I like about him, and he said, where he got started as a lawyer, as an attorney, like getting involved in cleaning up the Hudson River in New York. The Hudson River used to be so polluted that there was no fish in it. So he had fishermen, buddies that were his that were fishermen, that would go up and down the Hudson, and that was their living. That they fish. But it got so polluted, they couldn't even, it was killing off all the fish. And then the fish they would catch were so full of toxins that they couldn't sell them. So it got bad enough on the Hudson River that there used to be fires on the surface of the water because there were so many chemicals. And so RFK, environmental attorney, started going up and down the Hudson and finding people that were dumping crap into the water, these chemicals into the water. And because of the work that he did, the Hudson River is now one of the cleanest rivers in the United States because he got all the crap cleaned up out of there. So, and what he used to say was there's mercury in the fish. They're dumping mercury in the water. The fish are living in those mercury-filled water, and they're getting mercury in their tissue, and then you can't eat the fish because it has so much mercury in it. And so his job, his quest was, I'm gonna get regulations set so there's no more mercury in the water so we can eat the fish. And so he says, one of his famous lines is, people weren't calling me anti-fish when I was trying to get the mercury out of the fish, out of the rivers, right? It's the same thing with the vaccines. You're just asking questions. Are these things safe? Have they been tested appropriately?
Right.
They haven't been. They haven't been. So I'll talk about, we can jump into vaccines too.
Yeah. And before y'all, people, they like to get at you if they see you.
Fair enough.
But they got to realize it's not only him speaking about the food. If you go on Instagram, you see the girl called the Food Babe. It's a guy called Yaki Awakening. They talk about what's in our food.
Man, it's all over the place. Yes. Sam O'Hooley is another guy that posts about this stuff. He does a lot of the stuff, the carnivore diet. Everybody's talking about it. There's crap in our food. It shouldn't be there. Yeah. In particular, not only the chemicals, not only the chemicals, those are bad enough, but you start looking at like the imbalances of like the omega-3, omega-6 that we have in our diet. It's horrendous. It's creating all kinds of inflammation in our system. It's all over. It's terrible for you. So, but food companies make money on it, and it provides stability on the shelf, so they can make a loaf of bread and it can sit there for 2 months.
Right. I've been seeing people posting about. I haven't tried it, but bread they've kept for a year and go back.
Yeah, exactly, man.
Yeah.
You know the first guy that did that, one of the first people that did that was the guy, I forget his name now, but the guy that did the documentary on McDonald's, Super Size Me. Morgan Spurlock, I think is his name.
I didn't see that one.
Yeah.
I've been hearing
Oh
about
my gosh, this is what kicked it all off. This guy's awesome. You should watch it. It's hilarious. Actually, the guy died. I forget how. He actually had another serious health problem, but he set out like a burger and French fries from McDonald's, and put it under like a piece of glass.
I seen something like that. That might have been him.
Yeah, dude. Well, then it's like you start doing it with anything. You know, you're like, holy crap, this food's not changing at all, and animals won't eat it.
Right.
You know, it's like it just sits there forever.
Yeah.
Anyway,
as y'all can see, me and Dr. Martin, we can go on and on.
Yeah.
So go ahead.
I want to say one thing. A lot of people are like, well, RFK is not a scientist. He's not a medical doctor. And then they'll say things, because I hear it too, because I'm a chiropractor. I'm not a medical doctor. And people will say things like that. And have you heard of, what's it called? Logical fallacies. Have you heard that phrase before?
No.
Logical fallacies are like, if you can't win the argument, like maybe you like call the person a jerk. You know what I mean? It's like, or you like say, well, you're from New Hampshire, so therefore your argument doesn't make any sense. You know, it's like you're totally like going off, like it has nothing to do with the actual argument.
Yeah.
You know, it's like, you know, we're arguing about something and you don't like my point of view, even though I might be right. And so you say, well, you're bald. You know, like, well, okay, I am bald, but that doesn't make my argument wrong. You know, so people say that a lot of times about chiropractors. You know what I mean? It's like, well, you're just a chiropractor, you know, so you don't know what you're talking about. And it's like, well, who would know then? You know what I mean? Like what degree do you have to know? And so there's two arguments there. There's two things that can go wrong. One is you blame something about the person. You try to like defer or like distract from the argument by pointing at something else that's totally unrelated to it. And then there's another one where you say, well, I'm listening to this other person because they have a better degree or I trust them more. And that's called an appeal to authority. And when you're arguing with the person and you say something that's kind of negative about them to try to like discredit them, that's called an ad hominem argument. It means you're attacking the person, you're not attacking the argument.
Right.
And so you can attack the person and not the argument, or you can say, well, your argument doesn't make any sense. I'm going to trust this person because they have a degree or they have some, like, it's called an appeal to authority. Like, it doesn't make the argument any stronger just because somebody else says it. It's like the argument is either strong or it's not strong. So if RFK says, we should be asking questions about the safety of vaccines, like, it doesn't matter. I mean, my 4-year-old kid could ask me about the safety of vaccines, and it's like just as strong of an argument. You know what I mean? My kid's not a medical doctor or a scientist either. You know what I mean? It's like that's a legitimate question. Like, are the vaccines safe? Is our food safe? Is our water safe? Is putting fluoride in our water safe?
Right.
So here's an issue for whether you're black or white, it doesn't matter. Like, should we be pouring what's a known industrial toxic waste product into our water when we know that it lowers our IQ?
Yeah. I asked my dentist about fluoride, Yeah.
Man,
I went through a little thing where I didn't buy toothpaste or use toothpaste with fluoride, but I went back to it. Now we talking about I have to go back to it again.
No, I'll tell you what to get. Usually it's baking soda.
Yeah, baking soda. Yeah, I seen that.
Yeah, that's
baking
all you
soda.
need. It's cheap. Yeah. It's super effective. It's safe. Dentists used to lie about this, by the way. They used to say that if you use baking soda, it'll like grind down the enamel off your teeth. Total BS. Right. Not true at all.
Right.
So yeah, you're way better off using that. You get rid of anything with fluoride in it, man. You should. You know, the back of the package, what it says on toothpaste.
If you swallow a certain amount or something,
pea-size amount. It used to say pea-size amount, and now it just says if you swallow more than a normal amount, then you know who you're supposed to call?
Ooh, 911, right?
Poison control.
I don't know if I've seen that. Poison control.
You call poison control if you swallow if you swallow toothpaste. You're supposed to call poison control.
Now I have went away from the different types of deodorant. So I know a guy.
All right, good man.
I got some coming on the way.
All right.
yeah. I had tried a couple different ones, natural ones, but they didn't work too good. But I found.
All right.
a guy.
I use that rock salt one. I don't know if you used that before. So
now you know use that one.
It's not an antiperspirant. It's just a deodorant.
Right.
So
deodorant.
but it's none of the aluminum stuff that like blocks up your pores and creates lymphatic congestion.
A lot of people don't know about this stuff, man.
I know they don't. Nobody's asking questions.
Yeah, I gotta ask questions.
You gotta ask questions.
The deodorant you're using
is trouble. The antiperspirant you're using is trouble.
Yeah.
It's man, you can't stop asking questions. You got to always ask questions. That's, I think, it's kind of like what drives life. But if you're not asking questions, that means you're just like listening,
going along.
You're just like taking in information and not thinking about it.
Right.
And you're going to be taken for a ride. You're going to be taken advantage of. You're going to be.
And I always tell people, eliminate what you can. Because we're not going to be able to eliminate everything, but eliminate what you can. If you can stay away from this, do it. I mean, it might be something over here that is harder to stay away from, but less is possible.
Yeah, I respect you for since I've known you. I felt like you've always like wanted to know more. Like you've always like tried to ask questions. You've always been like coming in with information, trying to understand it. It's like you've always, I think, been really good at that. And you can tell. I mean, your health is important to you. You know, it's like you want to like enjoy your life and like get the most out of it and move forward and achieve and grow and that's the mentality I think that people need to have.
Right.
And if you're just sitting back and like just doing what everybody else is doing, I mean, look around. We're not in a healthy place. You know what I mean? Like we're not a healthy country. Like the United States is listed as something like the 30th.
Yeah, that's terrible.
Or lower, or lower, depending on the study. But the World Health Organization puts these like lists of healthy countries out. This is not even like developing countries, like supposedly like developed countries, industrialized countries. Like where does the United States fit in? I can tell you, we're scraping the bottom. We're doing we're doing crappy. So it's like whatever we're doing isn't working, but like. Nobody wants to do the hard work of like asking the questions and making changes, So, you ever heard of the book? It's a book called Turtles Down Under.
No.
Man, if you look that up or just look up a summary on whatever, ChatGPT or something or Grok or whatever you're using. The first chapter of that book, basically, just going back to vaccines and RFK, it basically says when you're testing a vaccine, the way that they're tested is you're taking the full vaccine and then you're testing it for safety against the full vaccine minus the one part of that chemical solution that creates the immunity. So, for example, a vaccine is made up of a bunch of different parts. So you got 15 parts that make up the full vaccine. Then you're comparing it against almost the vaccine. It's 14 parts. They take out one of the molecules. And so you're given a chemical soup in the one group and you're given a chemical soup in the other group. Both of them have crappy health outcomes, but they can say, well, the vaccine is just as safe as this other chemical soup. But what they're not comparing it to, and this is RFK's main point, what they're not comparing it to is a placebo. They're not saying, hey, we're going to give you vaccines and we're going to test them against a sugar pill or a salt pill or nothing.
What do they call them? Randomized?
Clinical trials.
Okay.
None. How many vaccines are on there? None. Zero. Zero vaccines have been safety tested like this.
Right.
And that's the main point of people that are like asking questions about vaccines. And then you know how many randomized clinical trials they've done with the full vaccine schedule? Zero.
And that's why you can't. It's hard to sue, or you can't sue, or you sue them in
in the 80s.
injuries.
That's right. And I think it was in the 80s. It might have been under Reagan. I can't remember. But basically the pharmaceutical company got shielded protection from the government that you cannot sue them for injury. Now there's a special vaccine court that it's an administrative court. It's not a traditional court. Where you can go, but it's very, very cumbersome. And the whole system's screwed up, and we could talk about that another day if you want. But
yeah. Now, we're going to get back to the chiropractor.
Oh, we got to get COVID too.
Yeah, we got to get back. Why? But I want to ask you this. People are going to say, you're a chiropractor.
Yeah.
What do you know about vaccines? How do you know?
Yeah.
Like, we've been getting vaccines for years and years and years and years. That could mean we've been getting messed up for years and years and years.
Yeah, exactly. Look around. Exactly.
All right.
Look around. I mean, okay, first of all, how do I know? Because I read. Because I read. I mean, I've been a chiropractor for 25 years, and I was in chiropractic school for the 4 or 5 years before that. So for almost 30 years, this has been like in my, I don't want to say wheelhouse because I'm not the one administering the vaccines, but I've been reading, listening, talking to, watching, trying to understand like what is happening with vaccines. And I'm telling you, if you read the first chapter of that book, Turtles Down Under, you're going to be like, holy crap. Like I'm never doing another vaccine in my freaking life. They're not safety tested.
Right.
So again, why is there a huge increase in autism? We don't know. But well,
I have about 5, 6, maybe young boys in my family that are autistic. Is it more in little boys than girls? Is there a difference or?
There is a difference. And I'll tell you one other thing too. And I can't remember if I mentioned this to you before, but there was a study done with the MMR shot. Oh, this might have been 10 years ago or so now. I should have looked this up before I came in here. But the rate of autism in young black boys, little black boys, was significantly like 3 or 4 or maybe 5 times higher in the group of boys that were vaccinated with an MMR shot versus the same group of kids that were not vaccinated with the MMR shot. If I were a black dad and I had a boy that had autism, I would be on fire about this issue. I would be ripping mad. I've been mad for almost 30 years, listening to vaccine BS. And, but if I had a kid that were every parent that has a kid, let's put it this way, every parent that has a kid with autism should be like, let's ask more questions, so, and so just to accept the fact that like, scientists, the government, pharma companies are just saying the same stupid line over and over again. They're safe and effective. They're safe and effective. Stop it. Like, show me the safety studies then. Where are the studies where it says, this is the medication, here's the placebo. We know there's no negative outcomes about it. Some of the tests that are allegedly done for safety are only run for a few days at a time, Leon. Literally a couple days at a time. And I don't know if you know this, but like something like 80% of kids with autism had their shots, had vaccines within 2 weeks of having.
Yeah, I do know that.
Yeah, you're like, what? Well, there's some kind of relationship here.
Yeah.
So let's figure it out.
I know I've seen some doctors that do give vaccines say that if the parent is going to give the kids vaccines, do it on a set schedule, not the schedule that they give.
That's right. It's an alternate schedule.
Yeah, alternate schedule. You space them out.
Yep.
Yeah.
That's maybe a good idea. That maybe limits the risk. But you know what? I've got 2 4.5-year-old boys. You know how many vaccines they've had in their life?
None.
0. 0. Do you think, did they die of whooping cough? No. Did they die of measles? No. Did they die of rubella? No. Did they die of pertussis? Which is whooping cough? No. It's like, no. So your bodies are made to heal. Our bodies are made to be healthy and strong if you give it what they need. If you give it what they need.
Yeah, but I've seen, I think I got a cousin that her last few kids, maybe, that she didn't give any vaccines to. I'm not sure, but I know it's a number of people that their kids haven't had and they're healthy.
Man, I'm going to guess that maybe people that if anybody's listening this long into the podcast,
right.
I'm going to guess most people do not know that with the advent of a lot of the early vaccines, that was also the time that public health became a major issue in the country, which means three things. Not putting our sewage right directly into the rivers, taking care of our garbage and not just letting like garbage sit out in the street, and chemically treating our water, like pure, disinfecting our water before we drink municipal water supplies. Those are the three things that most, even people in public health, if they're really honest, those are the three things that probably eliminated more disease than anything else, way more than vaccines, is treating our water, cleaning up our garbage, and not putting, can I swear?
Yeah.
Not putting shit in our water.
Yeah.
Just literally. I mean, literally.
Yeah.
Shit.
Yeah.
So cleaning up our water supply. Don't dump sewage in the water system. Filter and purify the water, disinfect the water, and pick up your garbage and put it in one place, like a dump. So you know who we should be thanking? Like every year, at Christmas time, we should be like giving our garbage men, little thank you cards, right? Mm-hmm. We should be driving down to the water purification center in Durham and like just saying thanks to those guys. And for the sanitation people, people that are like taking care of the septic system, the sewage system in Durham. Should be thanking those guys. Those guys save millions of lives.
I'm gonna say this, and then you don't got to answer, but have you? Well, just say yes or no. Have you heard about the birth control that's supposed to be in the waters now? They say it's going through the systems.
Yeah.
Go
I
ahead,
sure have.
Give
Go ahead. No, you tell me. You tell me what you heard.
Nah, that's all. I heard. It's getting in men.
100%. Your sperm count goes down.
Sperm count goes down, and
big time.
Yeah,
libido drops. Yeah, for men. 100%.
Yeah.
You know what else is in there? Antidepressants.
Yeah.
SSRIs.
Yeah.
I mean, so
all
you got like
water.
Anxiety medications are in the water. It's in the water.
Yeah.
So you take. I mean, this isn't like we're not making this up.
Yeah.
Like you can go
read and listen.
You can go look this up anywhere you want. There was about 6 or 8 years ago, right before COVID, a big study done on like 100 of the largest municipal water supplies in the United States. And every single one of them had antidepressants, and mood-enhancing drugs, and birth control, like estrogen compounds in them. And every single municipal water supply had that. So whether you want to take medications or not, you're taking them because they're everywhere. People are, you take them, they get excreted, they end up in our water supply. So yeah, there's more work to do.
Right.
There's more work to do.
Yeah.
But all of us are taking that crap. And yeah, you wonder, well, geez, men's sperm counts have gone way down, and girls are developing secondary sexual characteristics, which is, anyway, that's a big topic. But girls are developing secondary sexual characteristics, meaning breast development and starting their periods when they're like 8 and 9 years old now. It's crazy. It's a way too early because they're exposed to so much estrogen through weed killers and herbicides and pesticides and all the plastics that are in everything. It's like incredible. It's incredible, man. Yeah.
You say weed killers, man. We can go on and on. Weed killers. I be doing grounding, and sometimes I go out in my yard, but I think about, is this good for grounding me walking and they spraying my yard?
I know. You can't make sense of it. It's unbelievable.
But anyway, let's get back to the chiropractor.
All right, right on.
So walk us through the process of walking in your office for a first visit and getting seen.
All right, first of all, people come in for all different kinds of reasons, right? So most people are familiar with it for like pain, neck pain, back pain, something like that. So that's probably 70 or 80% of the people that come into the office. Some people come in because they have more complicated problems that that have been developing for a period of years. Maybe their arm is numb or tingling. Maybe they've got something maybe like called foot drop, where the nerve to the muscles in their legs is so weak that the muscles atrophy and they can't use their legs and their foot anymore, for example. Maybe it's something chronic like migraines or chronic type headaches. So that's kind of a second level of type of person that might come in. Then there's people that just come in for like wellness and preventative reasons. Like I'm healthy and I want to stay healthy. Parents bring their kids in, little babies in, to pick up on little problems that maybe are developing, like torticollis, where the neck is like cranked over to the side. People send their kids to the physical therapist for months at a time for something that's sometimes very, very simple to fix that we can address. Ear infections. Parents will bring their kids in for ear infections. Problems latching when they're not feeding. They're not connected to their mom. They can't turn their head the right way to feed on one side or the other. So there's all different kinds of reasons that people might come into the office. What's the process? We ask questions to figure out what's going on. What are you here for? What's going on? How did it start? How does it interfere with your life? What do you need to? Why do we need to fix it? What's going on? Mm-hmm. And then we usually, on almost everybody, unless there's a reason to not do it, we're going to take an X-ray on people. We're going to look at what your spine looks like. We're going to look at your structure of your body. We're going to look at how it's moving. We're going to look at how it's aligned, and we're going to then try to pinpoint exactly where those problems are in the spine. Now, I practice a special chiropractic technique called Gonstead. And there's a few, maybe 1,000 chiropractors out of all of us across the country, out of maybe 100,000 chiropractors in the United States. There's maybe 1,000 of us that practice Gonstead. It's a special technique where you're using like a thermometer, an instrument to like identify where there's inflammation in the spine, where the spine's not moving the right way. We look at the x-rays very carefully. We put our hands on the spine and like test and check the movement, get feedback from the person. And then basically it's kind of like braces on teeth. Like if your spine's in a wacky position and not moving the right way, then it needs to be guided back to a normal, healthy position. And so it's kind of, like I said, it's like braces. You're putting that on. We don't wear anything in our office, but we through pressure that we apply with our hands, then we start to nudge and free up those restricted areas in the spine. And guess what? Your body likes that. It's kind of like it doesn't want to walk around with like a cast on your elbow, for years. So your spine doesn't like to be jacked. Your body doesn't like when your spine's jacked up for years at a time. And so we get in there and start working those areas into a better alignment and better position and free those areas up to start moving and healing. And your body likes that. And so then you see cool stuff. Like people are sleeping better, their digestion's better, they don't have headaches, their sinuses clear up. We just had 2 people in the last month tell us that they've gotten off their blood pressure medications because it like calms your body down sufficiently that you don't need to be trying to chemically take the medications. Kids respond really, really well and very quickly to chiropractic adjustments. So we just had a kid in for a weird ear infection situation. It responded extremely well. Another kid that had, again, a torticollis, I mentioned, his head was kind of cranked over to the side. He had done a bunch of physical therapy, didn't help him. So anyway, we see all kinds of stuff. And generally speaking, there's a group of visits. You need to be seen at kind of a group of times close together in the beginning. And then we kind of start spacing those visits out periodically. But it's a little bit like going to a gym. It's like, can you go once? Is it a benefit to go once a month to the gym? Like, yeah. But in the beginning, like you're probably not going to make much gain if you're going once a month. You know what I mean? Like you need to, in the beginning, if you're going to the gym, you're trying to get a certain outcome. Like you need to go a number of times kind of close together to make changes. If you're jogging, trying to train for a marathon, like you can go out and run once a week, but you're probably not going to finish the race.
Right.
So that's what it's like. The treatments are really gentle. I mean, what's it been like for you? I mean,
it's been great. When I first went there, I hurt my back. I want to say that's around 2015. It's probably been about 10 years, 11 years. Yeah. And it's been
2015, I opened up my office here in Durham.
And
so yeah, it was right after that. 2015. Yeah.
No, it was before then. So if you open your office in Durham, I was over there in the old office.
No, that's the office I opened. Yeah, that's the one I opened in 2015. That's right. Yeah. I opened up this one in 2018. 18. Yeah, it's 2015.
Okay,
was the old one. Yeah,
okay.
The old one was 15.
Yeah, okay, yeah. Do you remember I had a little stinging pain on my left foot? You remember that?
No.
I kept having this stinging pain in my foot. It's like a needle. Like I would step and I would think something is like going on.
Yeah.
And I came and I told you about it and you did something. I ain't had that pain since. I don't know what it was. What do you think it was? Do you say you don't remember? I know you see a lot of patients.
Yeah, man. I mean, joints get jammed up in your body, from falls, injuries, stresses, crappy posture. I mean, joints and parts of our body get jammed up, and then they stop working the way they're supposed to. And when they start grinding in ways they're not supposed to, it damages cartilage, it stresses tendons and ligaments, it puts pressure on nerves and on other kinds of tissues. And your body reacts to that. It doesn't like it.
Yeah.
So then you get weird little jolts of pain or reactions to that stress. So yeah, you take those joints that are jammed up and free them up, and
Yeah.
It's a miracle sometimes.
Yeah. I couldn't believe it. I was like, okay, it was
Yeah.
good. You said, you like, here, let me see that.
Yeah, exactly. And how many times have you come in, would you say, where I've done like a treatment and you just like screamed your head off, like you just cried like a baby and walked out in pain?
Never.
No?
Never. Don't be scared, y'all. Go to the chiropractor. This is Dr. Martin, David Martin, here in Durham, North Carolina, Fayetteville Road.
Right on. Thank you.
And what's the name of
Precision Chiropractic.
Precision Chiropractic.
Yeah,
I knew that. I just wanted to tell y'all
that.
that.
I love it.
Yeah.
So no, I mean, it's funny. Like I can't remember ever you like screaming or crying, trying to hit me back, right?
Yeah.
Like
I might go woo.
like woo, it wakes you up.
Yeah,
It'll wake you up sometime. Yeah, but it's all right. A little stimulus to the nervous system. What do you think about COVID? Give me a 30-second summary.
Like I said, I was in the beginning of it. I always knew. I used to listen to this guy named Dr. Buttar, who really put a lot of things out there in the beginning.
Yep.
And that's when I started doing a lot of my research.
All right.
Find out about it. Of course, now that it's coming out,
Yep.
it's safe to say now, people are really realizing that it was, manufactured.
Yep.
Some people still don't believe it. You still see people walking around and scared and nervous and with masks on. But it was, even though it was real in the aspect of hurting people, it wasn't natural.
Right.
So that's what I didn't like about it. It was bad. It was bad.
Yep.
Yeah.
I wanted to say something. You might edit this out. That's fine. But I don't know if you remember, I have 4 adopted kids. They're all Latinos. They're all from Peru. Did you know that? Do you remember that?
I don't remember them being Latino.
Yeah. We adopted them in like 2014, right before we moved down here. They were 13, 14, 16, and 16. And so when we got into the COVID period, they all had, kind of your typical jobs, working at a grocery store, working at a restaurant, bussing tables, just kind of, they're just like learning the ropes, kind of like getting into the system. And one thing that just drove me absolutely bananas during COVID, remember they were saying some people are essential workers?
Yeah.
You know who was disproportionately an essential worker, which by the way meant you have to get out there and deal with the public, even though you might be exposed to this terribly deadly virus. Do you know who was sent out disproportionately? Black and brown kids. Go to the grocery store.
Wow.
Who's standing behind when I went over to Harris Teeter and at the time it was Kroger, and I'm standing in line, like everybody's got their masks on. They want to kill me because I don't have my mask on. And you know who's standing behind the counter? Black and brown kids. Behind those really like uber safe protective pieces of plexiglass. Remember that?
Yeah, uber safe.
Yeah. So it's like you got my sons and my daughters like that are being told, oh no, you guys got to go to work because you're an essential worker.
Right.
Even though this deadly virus is flying around. Well, I'm just going to say a lot of the white people are sitting at home ordering their groceries.
Right.
Disinfecting their bags before they bring them into the house.
Right.
Man, it drove me nuts. You could edit this all out if you want.
No, we ain't got to. But I don't do no editing too much.
Man, that drove me crazy. It's like people should be irate about that. And
I think more people are starting to be mad now than they were once they start learning about it. But you still have a few that's going to believe it.
Well, it should create distrust is what it should do. It should create a healthy distrust. And you know what distrust makes you do? Ask questions.
Right, ask questions.
Let's just bring it around to where we started off here. Just like ask some questions. Like, what a coincidence that the most novel and deadly virus, this COVID virus, like happened to start in the same exact city where they're testing COVID viruses in a secret lab in Wuhan, China. Like, what a weird coincidence.
Yeah.
Yeah. Anyway, the whole thing, the vaccines, they're safe and effective. The vaccines stop transmission. No, they don't. They prevent you from getting sick. No, they don't.
They definitely.
They
I
don't do any
know
of it.
people who had the shot, and they probably had COVID probably at least 3 or 4 times.
It's unbelievable. Yeah. It doesn't stop you from getting sick. It doesn't stop transmission. Mm-hmm. It's not safe. So we've already eliminated the effective part. Mm-hmm. Anyway, the whole thing is like, it's the perfect example, and we all had to live through it. You know, it's the perfect example of why you should like ask questions about your healthcare. Mm-hmm. It's a perfect example of why you should like take charge of your own health. Mm-hmm. You know, and I'll just say this, like nobody's coming to save you. No. Nobody's coming to rescue you. Mm. You know, and nobody's coming to rescue you. Right. Nobody's coming to rescue me or my kids. Or right. It's like you have to ask questions because you're at the end of the day, and you do have to listen to people that you trust ultimately, you know what I mean? But you have to ask questions. You have to do a little bit of research. You have to like push a little bit harder, and because you are to a big extent like responsible for your own health, mm-hmm. and your body's meant to be healthy. It's meant to last and heal and repair for many, many years, like 70 or 80 years. And if you look in the Bible, it was even longer. Like people are living like 120 years, like on average. So like in one of the Psalms, it says like you've given men 120 years. Mm-hmm. You know, it's like 120 years. We should be, you know, look at some of those blue zones, like I think National Geographic or BBC, I forget, one of the, have you seen that?
I've heard people talk about the
blue zones. Blue zones are where people are like living on average over 100 years. It's crazy. We're meant to. If you're living in a healthy lifestyle, you got some community, you got some healthy food. You're resting, you're moving. You've got a healthy lifestyle. You've got some convictions and some beliefs that you can live by. Some spirituality. I mean, these things are common factors in these communities that are living to be over 100 years old. We're like that too. We're not meant to be unhealthy, sick people. We're not meant to take tons of medications our whole life. Our bodies are meant to heal and repair themselves. And nobody's coming to save you. And in fact, it's opposite. They're coming to get you. Right. They're coming to medicate you. Mm. They're coming to sell you a product of medication and a lifestyle chemical that you need to be taking your whole life. It's not right.
So what do you think about supplements?
Well, look, I think those are important. I think supplements are hugely important, and here's why. Not to sell a product. I mean, I would in a natural environment with healthy food, with foods that are grown in real soil. I think supplements are not necessary. All right. But the food that we're growing isn't grown in real soil. You know, so you take like glyphosate or some of the other like chemicals, some of the herbicides and pesticides, those things, they're antifungals. They get into the soil and they kill all the organisms in the soil as well. So like you're not really eating real food anymore. Mm-hmm. So what I tell my patients is like try to eat real food as much as you can. That's kind of like the bricks in the wall. But then most of us probably have to have supplementation to fill in the gaps between the bricks to make it really strong. If we were eating real whole foods, organic foods on organic soils, without a bunch of chemicals coming through our food chain and water supply, we probably wouldn't need them. All right. But because most of us can't live like that or aren't living like that, then it probably is necessary for most of us to be taking some supplementation.
Do you have a garden?
We do.
You do?
We sure do. Yeah.
I started one a while ago. This is a little small one. I didn't keep it up.
That's all you got to do. Get a little small one. Yeah. We do, and we have chickens. We got chickens in Durham. We live in Durham. We've got you can't have roosters in Durham allegedly, but plenty of people do, but we don't. But yeah, we got chickens.
Do you sell eggs?
No, we don't sell them. You know, you got to have a lot to sell them out. But there's a company that I could connect you with a farm that does sell them.
Okay, do that.
They deliver them too.
See, that's another thing. Your eggs, people. Oh my God, man, we can go on and on. Man, all right. Some of your eggs ain't good. I'm just gonna tell you.
All right, if anybody actually likes what we're doing here, I'll come back. All right, but this might be your least viewed podcast ever, and that's okay. I won't take it personally.
No, it shouldn't be. Of course, people go want to listen and critique anyway. So
fair enough. Yeah, it's all right. I can handle it.
Yeah. Now, is there any particular people that should see a chiropractor more or less? Like if they've never had an injury, do they still need to see a chiropractor?
Well, let me ask you, Leanne, if you've never, let's say, had a cavity, do you think you should still brush your teeth?
Say that one more time.
If you've never had a cavity, do you think you should still brush your teeth?
Yeah.
All right. If you've never had run a marathon, do you think you should still exercise or run or work out a little bit?
Yeah.
Yeah?
Yeah.
All right. I mean, if you got a spine and a nervous system, then you should be seeing a chiropractor.
Okay.
Period. Like everybody should see a chiropractor. Who's going to be motivated to go see a chiropractor? People that are either like really interested and proactive in their health, or people who have usually some kind of a specific problem that they haven't been able to get answers to. But everybody should see a chiropractor. Everybody. Little babies should see him. I mean, you kids, right?
Yeah.
Were you there for them when they were born?
Yeah.
What do you think of that? That's
Yeah, I
crazy.
know,
That's
right?
pretty wild. Yeah,
Yeah.
that's like, you won't forget about that.
Yeah.
You'll never forget that.
Yeah.
But it's not a gentle process. You know, it's not like you stand at the foot of the bed with your arms, you know, wide open and like just kind of wait for the baby to gently come out. You know, it's like a lot of times there's tugging and pulling and yanking on that little neck, you know.
Yeah.
You're cranking on that thing.
Yeah.
And there's a study out of Harvard, I think, that said like the average kid has like 180 pounds of pulling pressure on their neck when they're coming out with either, it used to be forceps with vacuum extraction and some of the procedures, even a C-section. Like they're, you know, it's not like they unzip a Ziploc bag, you know, open the uterus up and like gently lift the baby out.
Right.
You know, they make a tiny little incision, they reach in, they grab the head and they yank and pull and the shoulder's stuck and they're cranking on the kid's neck. Guess what? That kid should probably get checked by a chiropractor. You know? It's like everybody should be checked because that's how everybody came out. You know, and that's another subject for another time. But, you know, how we deliver babies in this country is crazy to me. But everybody has gone through that birth trauma, you know, basically. And even if you didn't have trauma in birth, you've been crunched up in utero. You know, you've been like jammed up inside of your mom for 9 months. You know, only jammed up probably for the last month, but but you're cranked all up and your spine's in kind of weird contorted positions, and it's helpful to immediately. I mean, I adjusted both of my little boys within the first couple of hours of them being born. Literally the first couple of hours. Literally, yeah. Little tiny guys. And they were born preemies twins. They were born at 35 weeks, and they had to spend a couple days in the NICU. And but in the NICU, they wheeled them in there. They got them cleaned up. They brought them in the NICU, and I gave them little adjustments. So they didn't even hear that noise. But yeah, man, you've watched the kids being born. It's rough on them. And then you watch them grow up. Your kids probably like never fell walking or learn how to walk or riding their bike, right? Your kids.
No, they have.
No, really?
Yeah, really. Yeah.
So yeah, the kids fall, man. I mean, that's what we do. We get on our bike, or we like jump from the top step, or like, you know, jump for dad, and we, you know, they miss, and you know, they fall. They bang themselves around. It just happens. And so you're jarring your body around, it shifts around. And we have a saying in chiropractic, it says, as a twig is bent, so grows the tree. You know, so you take a little twig and you bend it a little bit and give it 30 years, and that thing's going to be all crooked. And so if you can catch it while it's still little and small and guide it and direct it and protect it, then it grows up into a strong, what it's supposed to be. Yeah. So, but yeah, everybody should get checked. At the end of the day, everybody should get checked. But you know who I really like fixing? I mean, it's fun to like manage and maintain people's health. That's very cool. But you know who I really like fixing are people who've like tried going to their medical doctor. They've gone to a PT. They've done, you know, they're working out with their trainer. They've done yoga. They're doing acupuncture. They've tried like, you know, done tons of medications. And then they're just like, but I'm still struggling with this thing. That's the person I like fixing, you know, because it's like, let's get to the root of it. Let's figure out what the underlying cause is, and let's fix that thing. You know, so I like those challenges. I think it's a lot of fun.
So you like those people who come to you as a last resort, and then you prove them that you can fix them.
That's right. Yeah, that's right.
Wow.
Yeah. So, but everybody's different, and everybody's kind of fun to work with in a way, and it's also fun seeing people that have been under care for a long time. You know, and so a lot of times what we'll do is, you know, if we take an initial X-ray of you, and every few years that end up taking a new X-ray and a follow-up X-ray, when we see that we've protected and maintained the health of that spine over decades sometimes, where there has been no progression of degeneration or arthritis. Arthritis and degeneration of the spine are from misalignments. So people that are like, they have arthritis or degeneration, and the medical doctor looks at it and goes, oh yeah, I get arthritis. Like, I'd never go to a chiropractor. Like, that's you're the prime candidate for a chiropractor. You're the person that definitely should have been to a chiropractor 30 years ago to prevent that from happening. But now that you've got it, let's try to fix it. And what do you think is going to happen if you don't fix it?
Right. So is it ever too late for a person that?
It's never too late to receive chiropractic care, but
I'm talking as far as like they're so damaged that there's nothing you really can do.
Sometimes you reach a limit. Yeah, sometimes you reach a limit. Yep. But I can tell you, last week I adjusted an 83-year-old woman and an 81-year-old guy, among others. But these are the two people I just happen to remember, in their 80s. My own dad's 79. I mean, I adjust him. I adjust my mom. She's 78. It's like there's almost never a limit. There's almost never, everybody could benefit in some way. So like maybe there's one specific problem I can't fix. Right. You know, maybe it's too late for that area. Maybe you have to have surgery. You have to have a part removed or something. Who knows? But that's the last resort. Right. At the end of the line. Yeah. And I would do this at the beginning of the line. Yeah. So yeah. I mean, you know what it's like. It's like just prevention, man. It's like trying to take care of it. So
yeah. And do you mentor any other young chiropractors or like
I have. I'm trying to drag one into my practice right now. Okay. So yeah, hopefully you'll see see the person walking around. There's been a couple chiropractors recently that have come in, made their way out. I'm interviewing one person this week, and one person's coming down to spend some time in the office this week, and another one phone interview just to see if it's going to go anywhere. But man, I love it.
So would you open up another office full of chiropractors, or just keep the one?
That gets a little complicated.
Yeah,
that gets a little complicated. Yeah, it's just like easier to keep it close to home.
Yeah, people ask me all the time, you can open another barbershop? I'm like,
I don't know about that.
Got to put together a team. That takes a while.
I don't know about that. I don't know about that. Just keep it simple.
Yeah. So anything that we didn't cover,
man,
because we can go on and on. I know we can.
I know you talk about your life, and but I just got to say, like, I've known you for a while. I've heard your story, and I'm really proud of you. Yeah, impressed with you, and I've got a high level of respect for you, and what you've come from, where you're going, where how you make decisions in your life. Yeah, and appreciate you.
I appreciate it.
Yeah.
Look. He's also into real estate. We talked about that.
It's true.
A couple times. He's into it. Good.
I'll say this about that. And I know we've talked about this before, but one, I hope you buy that building. Two, I heard this on a podcast recently. I said real estate is the get rich slow game. Right. You hear about get rich quick kind of things. Yeah. This is the get rich slow game. Right. And I think it's great for everybody to be involved with it. I mean, so it's.
Give us a little bit of how you got started in real estate. How much time you got?
I don't know. Yeah. Basically, my dad dragged me around for a bunch of remodeling projects when he was doing some work. He's doing some contracting work. And, so I would help him. He then went to work for a company where he had to kind of be like, he called himself the jerk of all trades, not the jack of all trades. The jerk of my dad was a jerk of all trades, and but he'd figure it out. You know, he'd figure it out. He'd learn how to do a little plumbing. He'd learn how to do a little electrical. He hung sheetrock for years as his main career, and my uncle was doing like the taping, plastering, kind of spackling stuff. And but my dad bought this little piece of crap house, like $20,000, and fixed it up and started renting it out. And they just kind of got passed on. Like he kept doing that. He would buy these little pieces of junk houses, but because he knew he was a jerk of all trades, he knew how to fix everything. He would take this house that was like beat up and just clean it up a little bit and rent it out. And he never really made a lot of money on it. But after years and years and years of those houses, like people paying the rent, and 30 years later, the house gets paid off. Well, now he's got a paid off house. And another 30, not another 30 years, but like moving down the timeline a little bit, 4 or 5 more years go by, another house gets paid off. Now he's got 2 houses paid off. And so my dad, we never had much money in our family. In fact, I remember one Valentine's Day, I wanted to get Bugs Bunny, Looney Tunes, Bugs Bunny Valentine's cards. And my sister pulled me aside and she's like, man, my dad can't afford Looney Tunes, Bugs Bunny Valentine's cards. It's kind of funny to think about now, but we were like at this, basically like these discount like department stores buying Valentine's stuff, just because we didn't have money. But, fast forward 35 years, and my parents are doing all right now. Why? Because they got a bunch of paid off houses and they've been really careful with their money. And so I think everybody should do it, no matter what position you're in. Get together with some friends, pool your money together, live together for a little while. You've heard enough podcasts now. It's like house hack. Get in there, just figure it out. Just work it out with people. And I think it's a great way to go. So that's my first house was a three family.
3 family.
Yeah. You know how much I paid for it?
$500.
Man, I wish. $25,000.
$25,000.
Yeah, $25,000 for first duplex or 3 family, and I did the same thing, cleaned it up.
$25,000.
I know. Imagine that. Yeah. Imagine that.
Right.
You should buy every house you can for $25,000.
I know, right?
What are you gonna do? You gonna buy that building? We should do it.
We
should do it. Where's your wife? Tell her we're gonna buy it.
Yeah, we still looking at it. Actually, I meant to call this
realtor
lady. Yeah, realtor. So I'm still gonna check into it.
Yeah, everybody's got opportunity to like take the next step, man. You know what? And like not everybody, you're not gonna hit a home run every time.
No,
but base hit after base hit wins games. And so it's just like everybody listening here, everybody that and everybody that I know just needs to get another base hit. You need to take the next step. You need to do one more good thing. You need to like just keep moving. If you're sitting still and just not asking questions and you're just kind of like sucking stuff up, you're not gonna move forward.
You ain't gonna move forward.
Yeah, you gotta move forward. It's like impel forward, brother. Yeah. Exactly.
Impel, take action, move forward. Yeah.
Exactly.
Yeah.
Yep.
That's it.
I need one of your hats.
Yeah. Okay. Gotcha. Well, it's been good.
Man, thank you.
Yeah. There you have it for another episode of the Impel Forward podcast. And remember, seize the opportunity to grasp your dreams.
Every day.
Peace.